Thank you for joining us. Today we're going to talk about ear, nose, and throat. And with us is Dr. Peter White and Dr. Michelle White. Thank you so much for joining us.
Great to be here.
Before we get started, let's learn a little bit about you. Peter, we'll start with you. Tell us about yourself.
I came to Meadville 33 years ago and had been in practice in ENT for that length of time. And it is so difficult to get ENT doctors to come to Meadville, I had to create my own.
Tell us about that experience.
Well, that started 33 years ago.
I'm 34 now.
She's 34 now. So
Perfect.
So it was a very long-term recruiting plan.
And Michelle, we'll have to get your take on this here in a moment. But when you were young, is this a direction you wanted to go? You wanted to get into healthcare, or at what point did you say, this is the profession I want to go?
Oh, yes. So I was relatively fortunate in that it's something I knew from a very young age that I wanted to be a doctor. I tell people that I saw the respect my mother had for my pediatrician, and I thought, you know, she thinks he's something special, and maybe that's what I'd like to do when I grow up, and it worked out very well for me.
Michelle, tell us about your journey.
Yeah, so I think I also probably knew pretty early on that I wanted to work in healthcare. We obviously have a very sort of strong community healthcare program here, and I grew up in town here, and so in terms of careers, I was exposed to a lot of different healthcare careers. When I started to talk about becoming a doctor, he, wanted to be sure, are you sure that you really want to do this? It's a long road, and I really started to feel like, no, there's nothing else I'd rather do. And so went to college and then medical school, and in medical school, I didn't go in saying, oh, I'm going to be an ENT doctor. I was sort of curious about all options, but I realized it was what I was comparing every other option to, and that I liked it because you got to treat patients of all ages, you could perform surgeries and also do a lot in the office, and I liked the anatomy of the head and neck a lot. And so I think what's underlying this here is that I'm his daughter and we're very similar people, and so I think we're kind of drawn to it for similar reasons. And then I went to ENT residency, and considering job options afterwards and having the opportunity to work with my dad and be close to family seemed ideal.
That's great. Peter, if you talk about just ENT, because people hear ear, nose, throat, it encompasses quite a bit. Talk about that range of that type of patient that you see.
Yeah, great question. Because one of my concerns in medical school was that I didn't want to do the same thing over and over again. And as you've just said, there really is a fairly wide range of opportunity in ENT. And I was attracted to that because, as you point out, it's ear, nose, and throat. So we deal with complicated ear problems. We deal with complicated sinus problems. We get into allergies through our work with sinuses, and then you've got throat and neck problems. As Michelle's already alluded to, the anatomy in the neck is very interesting and intricate, and that's a big attraction. The other thing is we treat a broad range of ages as a surgical specialty. We have a lot of children, and for me that was another big attraction. I love dealing with little kids in the office, and the immediate gratification and satisfaction of the surgical procedures involved. They can't hear well, and then they can, and their throat hurts, and then you make it throat hurt for a little bit, but then it's better. And so, it's a great specialty.
Michelle, for you, is that sort of the same approach? Every day is a little different.
Yeah, you do find that, but then you see a lot of commonalities, and a lot of the same problems show up on the list of patient encounters from day to day. But you find that you're still approaching each patient, obviously, in a different way, and that one patient's ear infection isn't the same as the next patient's ear infection you'll see in the next hour or next day or something like that. And so you're constantly, with I think all fields of medicine, thinking, what's the best treatment plan for this patient in particular, and what works for some, what doesn't work for others, and stuff like that.
And that's why it's so important for somebody to schedule an appointment to come into your office? Because people will look online to try to get ideas, but every patient is unique. So that whole path they're on for treatment is going to be unique to them. There's no like rubber stamp that you're putting on, everybody. Does that make that, again, part of that enjoyment of what you do, that the challenge of, solving the puzzle?
Yeah, I think the word is challenge. We're dealing with human beings, and we're all a little different and complicated in our own way, and talking to people and figuring out their exact problem and sorting it out for them. It's difficult to cookie cutter that, and people deserve better than to be cookie cuttered into standard forms of treatment. So yeah, that adds to the challenge and the satisfaction.
Michelle, talk about just, again, some of those patients that you see every day. What are some common traits that you come across?
We see, in different age groups, we see children who have frequent ear infections or issues with their hearing and fluid behind their ears. And, we approach that patient with, does this patient meet criteria to get ear tubes in at this time? Are we going to keep monitoring their ears? Are we concerned that something more rare is happening, like there's actually a nerve-related hearing loss that isn't related to fluid or ear infections? Also see children with, problems with their tonsils and breathing and snoring and frequent strep throat infections. And then something you could see in any age group is, a swollen lymph node in the neck, and how you handle that in a child is different how you handle that in an adult, middle-aged, or elderly person. And then I think we have sort of a unique skill set in this specialty where we have special equipment to examine the ears, nose, and throat that isn't available to a primary care provider, like flexible scopes to look in the nose and the throat, microscopes to look in the ears. We can clean ears in a way that can't be done other places just because of the equipment and scopes we have. So a lot of the time you find patients are here just because they need a really good ear exam, or they need someone to look at their throat and their vocal cords, which is not something that can be done in a primary care office. So we just have an ability to look at these anatomic areas with a lot more sort of precision than others can.
When somebody is thinking I should make that phone call, should they call your office first? Do they call their primary care physician? How do they get into your services?
I would say either or. It depends on the nature of things, but we have a very strong primary care base here in the Meadville area, and it's my experience that they're very good about referring on when specialty care is indicated, but patients are also very welcome to call our office and make an appointment on their own. They don't necessarily need to see their family doctors.
Sometimes a patient will wait maybe too long before they start that process. What are some things, and we can start maybe with kids and then work our way up into older patients, but what are some things that may pop up in their lives where, if you're experiencing this, go and see the doctor?
For adults in particular, I think a big concern for waiting too long to seek intervention would be something like a head and neck cancer. And so if they have a swollen lymph node that persists more than, I'd say, like 2 to 4 weeks, or keeps getting bigger and doesn't go down, throat symptoms like throat pain, ear pain on one side, difficulty swallowing, change to their voice. If any of that lasts longer than a few weeks, that's certainly a very good reason to see an ENT doctor. Hearing loss in one ear that sort of happens suddenly, or even progressive decline in hearing in both ears, is a good reason to get a hearing test and see an ENT doctor. And then in children, frequent ear infections, like once there are more than 3 infections, 3 or 4 that require antibiotics, as well as a concern that there's some hearing loss or speech delay, all of those are good reasons to come in.
Q-tips. A lot of people talking about Q-tips. Use or stay away from?
Well, I tell patients from a a business point of view, they're excellent because they bring a lot of business into our office. But if you look not so carefully at an ad for a Q-tip, you'll usually see some attractive model with a Q-tip, and it'll go all the way around the outside of the ear, but you'll never see the Q-tip go into the ear because it's not supposed to. And it does generate a lot of work for us. People end up damaging their ears sometimes and pushing things like wax in there that ordinarily would come out naturally. So I would say overall, leave them out of your ear.
Allergies, another big topic here in Northwest Pennsylvania. Let's get into that because a lot of people will say, I've got seasonal allergies, or the allergy season's rough, and it seems like it's not just fall or spring or summer, it's year round. Talk about just what you see in the office when it comes to allergies.
Yeah, well, certainly this is a prime time seasonally for allergies with spring. And even in the winter, patients come in because they may have dust allergies or animal dander allergies that are sort of year-round. But we always talk about, what they've tried in terms of over-the-counter medications and if anything has worked well for them. And then we talk about an ideal regimen of over-the-counter medications because we can send in, the generic version to the pharmacy, but really there's nothing they get from the pharmacy that's different than what they can get over the counter. So what's considered sort of first-line allergy management is an oral antihistamine like Claritin or Tecalegra, or the generic equivalents, with a nasal steroid spray like Flonase, and saline's helpful in the nose during allergy season to sort of wipe out any allergen particles that are sitting on the lining of the nose. But that's sort of the most optimal treatment regimen, is an oral antihistamine with a steroid spray. And if they're finding that that isn't controlling things well, that's when we talk about, should we do allergy testing? Should we consider whether you should start allergy shots or drops, which is considered immunotherapy treatment. But patients want to be sure that, they've tried the over-the-counter medications, because that is a commitment in terms of the treatment, the length of treatment, and sort of how frequently they need to come in for shots and stuff like that.
So,
well, I was going to say there are lots of things that bothers people's sinuses, and allergies. The fact that we treat allergies is a natural extension of various kinds of other kinds of sinus treatments as well. For instance, we get into people who need sinus surgery, and again, allergies can become part of a broad range of treatments that we can offer people for their sinuses.
What's changed over the past 30 years in your profession?
Well, I think that our ability to use technology in the office has changed and improved over that time period. Certainly we have some improved allergy medicines, we have some improved antibiotic therapies, and by the other token, a lot of things have stayed the same. One of the beauties of this relationship is that I have more than 30 years of experience to impart on a younger person, and the younger person comes with new and updated training that helps to keep the old guy up to date. For instance, we are starting an Inspire program here because Michelle did that during her training, and that we hope will offer a new treatment for sleep apnea in the area.
And I understand there's already been phone calls, so what is Inspire?
Yes, Inspire is an alternative to CPAP for patients with moderate or severe sleep apnea. CPAP is still considered first-line gold standard therapy for sleep apnea for good reason, because it's very effective when it works well and it's non-invasive. But there are a subset of patients who don't tolerate CPAP for various reasons, or CPAP doesn't work well for them, and so this is a good therapy option for them. It is an implanted nerve stimulator device that works by moving the tongue and upper airway muscles forward to open up the upper airway during sleep. So there's a component that is moving the tongue forward while you sleep. There's also a component in the chest with sort of a pacemaker-like device that is sensing your breathing. And so with your respiratory cycle, it detects when you breathe in and moves your tongue forward to open up your upper airway, and then as you breathe out, it relaxes. And so as you sleep throughout the night, you're getting sort of cyclical movement of your tongue and upper airway to open up your upper airway when you're sleeping.
How is somebody diagnosed? Do they recognize sleep issues themselves, or are they coming into your office and saying, yeah, this is going on, and you're saying to them, I think it's sleep apnea?
Yeah, many patients by the time they get to us have had a sleep study in the past and have been diagnosed with sleep apnea, but it's funny you ask, how they recognize this, because a lot of the time it's the bed partners who are noticing
Right.
that, my bed partner snores loudly. I've heard him or her pause breathing during sleep and then kind of wake up. And so honestly, a lot of the time, maybe aside from poor sleep quality, which the patient would recognize themselves, it's more so family members, bed partners who are noticing the symptoms of it.
And what's the feedback you've been getting? Because I'm sure once somebody's getting a good night's sleep, it's a major difference in their life.
Yeah, we really haven't quite gotten to the point where the patients we've implanted are sort of giving us that feedback yet, just because it is a long process and we're just getting started. But from my experience in residency, many of them are very grateful because there are certainly a lot of health consequences of untreated sleep apnea. And aside from that, they are feeling like they're getting more refreshed quality of sleep. And sometimes it can be drastic, patients who are worried they're going to fall asleep at the road because they're so chronically tired and stuff like that. So it can be a major improvement in their quality of life.
If somebody understands that they have some sleep issues,
Mm-hmm.
they know they have sleep apnea, they can contact your office?
Yes, they can contact our office, and they can also talk to the provider who's been managing their sleep apnea. A good place to start if you don't know if you have sleep apnea is to talk to your primary care provider. They'd probably ask you some questions and consider whether you should have a sleep study.
Summer's coming up. A lot of families are planning vacations or getting out, even just mowing grass. If they're having allergy problems, that's another opportunity to contact their primary care physician or your office?
Absolutely. Yes, most allergy treatments are available over the counter, and so the simple way for them to start is to go to the pharmacy and get an antihistamine. And if their symptoms are easily well controlled with an over-the-counter medication, they probably don't need their family doctor or us. But we tend to see patients who have already gone to the pharmacy, and there's a broad range of different allergy therapies to try, and they just aren't working well enough, and then we're very happy to see those people and see what else we can do for them to give them a better quality of life.
Family is very important to you. What do you do at the end of the day to relax and wind? Peter, we'll start with you.
Well, the best thing we do is spend time together. And so, sorry, I couldn't talk about this without getting emotional. Yeah, the best thing we do is spend time together, and Michelle has 2 young children, and they are the joy of our life. But aside from that, we travel. I'm a bike rider, and we enjoy a pretty busy life.
Yeah, I will say those 2 young children take up all of my free time at the end of the day. And so after they go to bed, I like to, read or watch TV shows, but also I usually go to bed pretty early and get the day started early as well.
I'll ask, what's it like to work with Dad?
Oh, it's the best. It's great. Yeah, we are very much in sync and just obviously know each other so well that we work well together. And I notice, he's part-time now, so he's not always here, but when he is here, I take every opportunity to say, what would you do in this situation? And just get reassurance that, he would be doing the same thing that I'm doing, because why not use that resource when you have it?
Office locations here in Meadville and in Grove City?
We have an office here in Meadville that I've had for a long time. Recently, our office in Grove City was changed to Mercer, and so we are in Mercer 2 days a week.
And again, you can find out more by going to the website. Dr. Peter White, Dr. Michelle White, thank you so much for
Yeah.
your time. It was a real
Okay.
pleasure.
Thank
Yeah.
you.
Thank you. And thank you for being with us as well.